I'm back at Surfer's Dental. This is going to be my first checkup since I had those 3 large molars reconstructed, or they replaced those fillings. I'm pretty nervous. I'm always nervous before I go to the dentist. I'm nervous if it's bad news, because then it obviously then sits with you and you sort of think about it until you get it all fixed. But today I am booked in for that checkup and a clean, so all fingers crossed, we'll see what happens in there.
And how have you been feeling that large restoration that we did?
Oh yeah, like there's no pain or anything, like it's
comfortable to bite?
Yeah, it is comfortable to bite. Like I don't feel that this side has changed at all. Like as in when I bite down on this side, I don't feel it higher. It just bites down.
The big one. Alright, so let's start checking everything here. So wide open for me.
Yeah.
Bit of a stretch. Can you relax your lips so I can pull it? Good. Can you open really wide for me? Now pull your tongue out. I'm going to pull it a bit. Ready? Open the edge. Bit of pressure next to the tongue. On the other side. Alright, so I'm going to start checking your teeth now. A bit of air. Wide open for me. So what I'm saying is a bit of erosion on your teeth, top and bottom. So you're ready for the tray then? Can you close halfway? And yet the erosion that I was saying is losing tooth structure because of an acid environment in your mouth. So for that one, unfortunately, the treatment is not only for one tooth isolated, because most of your teeth are having this erosion. Can you open a little bit wider for me? Excellent. Your gums are very good though. There is no sign of inflammation so far. You do have a bit of recession, so they are not too large. Do you remember if you have split yourself here on the tongue? No? Yeah?
I do. Since these were reconstructed, it's taken a bit of getting used to, I think, so yeah, I have been biting a little bit.
It's just mainly because here you have a bit of a white patch that I'm going to kind of monitor there. Now let me check the bites. Bite together. Can you try to grind your teeth with your right side when I'm touching here? Yeah, come a little bit more. Push, stay there, stay. Okay. Bite together. Now try to do the same to the left. Yeah, stay there. Alright, that's it.
So can that turn cancerous if you continue to...
It's a risk, yeah. So when we see white patches in the mucosa, we have to always monitor it. Sometimes they can turn into something nasty. All depends on risk factors. So if you're not a smoker, if you don't trade alcoholic drinks like frequently, probably you shouldn't use any alcoholic mouthwash.
I do.
Yeah.
I use Listerine.
So it's better not to use it really. It's like a recommendation for everyone these days because alcohol could be too aggressive to the mucosa and the gums.
Yeah.
So there is not much benefit from having a mouthwash really. So the teeth actually will benefit more from brushing, leaving the toothpaste on, and flossing. So the mouthwash, it doesn't do, I would say the main job of the mouthwash is like freshening the breath. So, and of course there are some medicated mouthwash that they do have some deeper effect, but Listerine or the mouthwash over the counter, they are not like a big deal. And even so, if you, for example, if you brush your teeth and then you do the mouthwash afterwards, what you're doing is removing the toothpaste and the fluoride that the toothpaste is giving to the tooth to make it stronger. So it's washing it away, it's just reducing the effectiveness of the hygiene process. So I don't see much benefit from mouthwashes. Of course, there are different school of thoughts, but that is my opinion.
So you reckon brush your teeth and then while the toothpaste is on your teeth, actually floss?
Look, the flossing for me, as the most important thing is doing the flossing, right?
Yeah.
But what I recommend usually is to do first flossing. Okay. So you kind of remove everything from in between the teeth, and then with the brush everything is taken away.
Yeah.
Just spit out and don't rinse it. Just leave the paste on.
Oh right.
Yes.
Okay.
So that is the best way to make sure that the toothpaste with the fluoride is kind of strengthening your teeth against the bacteria that is causing decays or erosion as well. You know, because the fluoride makes the tooth stronger against erosion attacks. So that is what is ideal. So yeah.
Oh, thank you for that advice. That's good. Does that white patch look worrying to you?
Not at this stage. Like sometimes we see many of white patches in the mouth. Yeah. And for example, a person like you that you're not a smoker and you don't drink alcohol, so the risk it will be reduced. But it's always a good idea to monitor. So
could it go away? Do you think?
Usually they don't go away. It's just But I mean, if it's something like what we have to know is pretty much what is it because if it's something traumatic, if you are always catching the tongue in the same spot, probably your bite. And something that I was looking at your bite, I was planning to tell you is that you have what we call an anterior open bite. That means that your front teeth are not touching at all.
Oh, no, like that, yeah.
So this is making an imbalance, right, and that can affect your joint. So you will definitely benefit from straightening and aligning your teeth. So if you want to have a consultation with an orthodontist, I can always give you the referral. I believe that will be very beneficial for you. These days you can opt between braces or Invisalign to straighten your teeth, so it's much better than before. So it's a good idea. Yeah. And so many people think that this is something for teenagers or kids, and definitely not. So there is no limitation in age.
It's as you age, your skull changes anyway, or your jawline can change.
Yeah. So like for example, my mom, she's 65, and she just finished the aligning treatment because she was breaking her teeth in the way that the bite was changing. So she started to get some damages, forces in between her teeth. So she saw an orthodontist, and now it's everything much better. Alright, here we go. Quite open for me. Halfway, no? Close halfway. Close a little bit. Here. Excellent. Very good. Right, so now I'm going to go around with the floss to check all the areas between the teeth.
I know, it's hard. Yeah, that's sort of changed too. Like it's harder to get a floss through the teeth for some reason.
Yeah, that's probably because of your bite. And you know what? Your teeth are getting the erosion on the top, that they're getting very sharp corners that they cut the floss. You can have another piece. One more.
Yeah.
Good. So now we're going to the polish.
Oh yeah. This is now the least uncomfortable.
Yeah, this is the easiest part.
Yeah.
Can you close halfway? So now I'm going to flush away the tape. So open look of water. You can take another good rinse in there, and then we do the fluoride for you.
Oh, thank you. Well, if you were going to take an X-ray, would you do it now, like at this point?
Yeah, so it would be really good to take the full mouth X-ray then.
Yeah. So I mean, do you think they look like you won't find anything horrible and festering?
I don't know, I'm not a witch, but look, it's always a good idea. I think you need the X-ray for multiple purposes. You need to make sure that your bone is in a good stage, to see if also you have any decay between the teeth that we cannot see with the naked eye. And also that full mouth X-ray will help to analyze your structure for like an orthodontic treatment. But definitely you will benefit from it, because since all your teeth are getting worn down from your bite, from the erosion and position of your teeth, definitely the first, one of the main important steps will be realigning them to a better position. So,
before you do any reconstruction of it.
Yeah.
So are you saying that even if there is a little bit of decay, you think it's more important straight to get aligned?
So dental treatment should be by phases. So phase number one always is to control if you have any active decay or any active gum disease.
Right. Yeah.
So with that X-ray we can analyze that one. You have some fillings that I have recommended to replace and to resolve. So all those things will be ideally done before you start any orthodontic treatment. But for example, having the consultation with the orthodontist is always a good idea, so you can know what will be your best option, what is your plan, and what you want to do. If you want to go ahead with braces, or if you are eligible for clear aligners, those type of things are always a good idea to roll out as early as possible.
Right.
But definitely before starting the treatment, having all the things done in like fillings and decays are important.
Well, I might just hold off on the X-ray for now until we can sort of brace ourselves to get more work done on the teeth first.
Yeah.
And then where would be the orthodontics?
So usually refer to the guys in Medland. I think they have different offices around Gold Coast. So
is there one sort of close-ish that?
I have to double check the addresses, but yeah, definitely. Like I think they have in Robina, they have in different spots. So,
okay, I might just hold off for now.
Yeah, whenever you're ready, just let us know. It's just important that you know that you should do it.
I should do it. I know there's fillings that will need changing and all that.
And ideally, like for example, like as we did in this part, that we changed the filling in this part, which is the green.
Yeah.
We had the X-ray of that area, so we know how deep we can go. So for the other parts, it would be ideal to have X-ray beforehand as well.
Oh, before you change them?
Yeah.
So are you saying that I do already have fillings that would be an idea to change?
Yeah, for sure, because they are worn down, the edges are kind of debonded from the actual margin. So these, when we see fillings that these are deteriorated, they are defective, they are ideally replaced.
Yeah.
Right. So this one is the fluoride treatment.
Yeah.
So I'm going to you can speak. So we're going to put this one inside your mouth. We're going to leave it in there for a couple of minutes.
Yeah.
And then you'll spit everything out without rinsing your mouth.
Can you point out, is it possible to get a close-up of this white patch? Because my hubby's a doctor as well, and I'll get him to...
Yeah, for sure.
Would he, I mean, he's not a dentist, he's an obstetrician, but he's still medically trained. So
yeah, for sure.
He might still be able to know if
it's... We will take a photo and give it to you.
Oh, a photo, that would be great.
Yeah.
So you're sure it doesn't look alarming at the moment?
Yeah, no, not at the moment.
Because that's not what, like...
No worries, I will take a photo, and that is idea to check any changes in the future, alright? So I'm going to put this one inside your mouth, wide open for me. Excellent, keep it in there. That's it. Yeah. Rico, can we set the control camera, please?
Oh, yeah.
Yeah, open. Now we do your source. That's right. So this one, what it does, it will make the surface of your teeth more resistant against acid attack and bacterial activity. So that's why we do it every 6 months.
Right.
So you have some tissues here. I'm going to take it out, and then you're going to move that here around the teeth like if it was a mouthwash.
Oh yeah.
Keep it in there.
Not too bad.
Keep it in there for a minute, and then you can spit the excess into this cup, right?
Okay. Because cancer, oral cancer, that is one of my massive fears, and I'm always grateful when the dentist says my gums look fine.
Yeah.
But now if I've got one starting to fester on my tongue,
But look, the dog usually gets a lot of stuff because it's always in the middle of grinding and things. So.
I know.
Do you have anyone in your family that has suffered from cancer or anything like this?
No. I mean, my granddad died from leukemia, but that's not related to no.
Alright, you can sit now in there. And I'm going to take the photo.
But that shows why it's good to have regular visits to the dentist.
Exactly right,
If you did have one that was...
Yeah, so play back for me because
I mean, I do have one, but you're saying
but usually they are asymptomatic, you know, that is the thing. Yeah, so
yeah.
wide open for me, poke your tongue out. It looks very, like it's just something very superficial in there that probably it's just that you cut your tongue in there while biting. So it doesn't look concerning. Really.
It doesn't look concerning yet.
It doesn't, no. Alright, all done.
Thank you so very much. I really appreciate that. So next steps then are full mouth x-ray, work out what else needs doing in my... Because I know very well that once I have the x-ray I'll get all the news of everything that needs doing. So I think I need to get my head around the fact that I am going to need work. Then I'll get all the news at once type thing.
Alright, whenever you're ready. No. I don't want to push yourself, but yeah, like whenever you're ready, let us know. We'll take that X-ray.
And then once all that work's done, I'll go to the... Because dentists have been telling that though for years about my bite, and I've always had a loose joint. So yes.
So yeah, what I can see now in your teeth is, you know, like when you see the top of your teeth when you open, you have this thing that you have like some little dishes like this. So this is called by erosion, and that is kind of removing your tooth away. And then at the same time they are biting quite strongly because they don't distribute any loads to the front. So they are exposed to more wear. So
thank you so very much for your care. I really appreciate it. So I've got any bibs or glasses on or anything? No. Thank you. Thank you so very much. Have a good day. So there are two really important takeaways from what just happened in there. The first one is the importance of regular dental visits. Like, I never would have known about that white patch that's apparently now sort of developed on my tongue. No symptoms, no pain from it. I did realise that I was biting down a bit more on my tongue, and that is actually a really common issue. Bites can change. I have had dentists in the past talk to me about this alignment, and I've always had, ever since I was young, I've always had a bit of a loose jaw. I'm not sure one dentist did have a term for it, but so I do know about this issue, so I do think it is probably about time I did get something done about it, because that is true. Regular trauma in your mouth can lead to something really nasty, as in oral cancer, and that is obviously cancer is a big fear for everybody. So it's always good to see any warning signs of something that might develop into something not so good later. So again, if I hadn't have come here today, I never would have known about it. So go and see your dentist regularly. That developed in just 6 months. So I was here just 6 months ago. And dentists do say that once every 6 months to keep on top of anything that's developing. Second really important takeaway is, like he said, you're never too old to get your teeth realigned. And in fact, when you're older is probably when you're going to need your teeth realigned. Like he said, his mother, who's 65, now needs her bite realigned. And that is actually a very common problem, that your bite does change. So you don't have the one bite in your 20s and that lasts forever. Not the case. Nothing stays the same. So look, that was positive though, to get that. So I do understand that before you get your teeth realigned, you probably do want to just fix up any issues. So I will get that x-ray, and I will find out what else needs doing, and I will do it, and I will then go and get my teeth realigned. So like I said at the end of last video, lucky I've got a dental playlist, because the journey, I think, will just continue on and on and on forever.